Today, we're going to look into tests that comprise the Comprehensive Metabolic Panel, or CMP. This extensive lab panel provides a snapshot of your body's chemical balance and metabolism. When the ordering healthcare provider orders a CMP, the provider is basically ordering a basic metabolic panel, or BMP, and a liver or hepatic panel. This panel encompasses various tests including sodium, potassium, and many more, which help assess your kidney and liver function, electrolyte and fluid balance, and blood sugar levels. This vital information guides healthcare professionals in monitoring health conditions and diagnosing diseases. Before we dive in, a quick medical disclaimer. This video is intended to provide educational and informational content only. It's not a substitute for professional medical advice or treatment. Always consult your healthcare provider for any medical concerns. First up, the glucose test. This simple blood test measures the amount of glucose in your bloodstream. It's important to note that blood glucose is not the same as blood sugar, as sugar contains two molecules, glucose and fructose. Laboratory analyzers and home testing machines most commonly test glucose. The reference range typically falls between 70 to 100 milligrams per deciliter. If the body's glucose levels are consistently elevated, meaning hyperglycemia, this could indicate diabetes, or some type of issue with the pancreas. On the other hand, consistently decreased values are designated as hypoglycemia, which could also indicate an issue with the pancreas. Hyper means high and hypo means low. Glyce refers to glucose and emia refers to glucose being present in blood. Understanding these terms and their respective numbers is key to managing your body's glucose levels. Next, we examine the world of our essential electrolytes with the tests of sodium, potassium, chloride, and carbon dioxide. Electrolytes are essential for basic cell function and maintaining equilibrium in cells. First is sodium. Sodium helps regulate the body's water balance and electrical activity in the cells. Normal levels typically range between 135 and 145 milliequivalents per liter. High or low levels may indicate dehydration, kidney disease, or hormonal imbalances. Next up is potassium, vital for heart and nerve function. The normal range is typically between 3.5 and 5.0 milliequivalents per liter. Abnormal levels could mean kidney disease or imbalances in fluid and electrolytes. Chloride, another key electrolyte, assists in maintaining proper blood volume, blood pressure, and pH of your body fluids. Normal levels range from 96 to 106 milliequivalents per liter. Abnormal values can result from kidney or adrenal gland disorders. Lastly, the carbon dioxide test, which primarily measures bicarbonate in the blood, aids in balancing the body's pH. Normal values are between 23 and 29 milliequivalents per liter, with deviations indicating lung or kidney disease or metabolic issues. As you may have noted, these electrolytes have tight reference ranges. These ranges are important for homeostasis, or in other words, keeping things stable. These electrolyte tests play a vital role in understanding and maintaining the body's stability and function. Now, let's explore how the Comprehensive Metabolic Panel assesses kidney function. 4 key tests in this panel focus on our kidneys: the blood urea nitrogen, or BUN, creatinine, the BU-in creatinine ratio, and the estimated glomerular filtration rate, or eGFR. BU-in measures the amount of urea nitrogen, a waste product that the kidneys remove from the blood. Normal levels usually range between 7 to 20 milligrams per deciliter. High levels of BU-in may indicate that your kidneys aren't effectively removing waste, while low levels may indicate malnutrition, a low-protein diet, or liver damage. In some cases, low BU-in may be caused by drinking too much water, also called overhydration. Creatinine, another waste product removed by the kidneys, is produced through muscle metabolism. Normal levels for men are between 0.9 to 1.3 milligrams per deciliter, and for women, it's 0.6 to 1.1 milligrams per deciliter. High creatinine levels may suggest kidney dysfunction, muscle fiber breakdown, or malnutrition. The BU-in creatinine ratio helps determine the cause of these high levels. A normal ratio is between 10 to 20. A physician or qualified licensed healthcare provider can help evaluate those numbers. Lastly, the eGFR estimates how much blood passes through the glomeruli, or tiny filters in the kidney, each minute. An eGFR over 90 is considered normal. As you can see, all of these tests are imperative in evaluating the body's kidneys' health and performance. Moving on, we'll tackle the anion gap and calcium tests. The anion gap measures the balance of charged particles, or ions, in your blood. It can be a valuable tool in identifying conditions that disrupt this balance. The reference range for an ion gap is typically between 8 and 16 milliequivalents per liter. A high in ion gap may indicate conditions like metabolic acidosis, while a low in ion gap could be a sign of hypoalbuminemia or liver disease. Now let's discuss the calcium test. This test measures the level of calcium in your blood, an essential element for bone health and muscle function. The reference range for calcium is generally between 8.5 and 10.5 milligrams per deciliter. Low calcium levels may point to conditions like hypoparathyroidism or vitamin D deficiency, while high levels could indicate hyperparathyroidism or certain types of cancer. These tests are key to understanding the body's acid-base balance and bone health. Next up are the protein tests. These tests measure the total amount of protein in your blood, and through the individual levels of two major serum proteins, albumin and globulin. Let's delve a little deeper. The total protein test measures all the proteins in the blood. The reference range for total protein is typically between 6 and 8 grams per deciliter. High levels and low levels can suggest varying liver issues. High total protein levels may indicate dehydration or a more serious condition called multiple myeloma, which is a condition that causes protein molecules in the blood to stick together, subsequently thickening the blood and making the heart work harder to pump blood through the body. Low total protein levels could point the healthcare provider to a liver or kidney issue, or that dietary protein isn't being digested or absorbed as it should be. Further testing will be needed to see which of the body's proteins are indeed elevated within normal range or decreased. Moving on to albumin, which makes up about 60% of the total protein in the blood. The reference range for albumin is generally between 3.4 and 5.4 grams per deciliter. Albumin plays a vital role in keeping the fluid in the blood from leaking into other tissues. Also, albumin is what the body uses as a carrier molecule. In other words, certain medications and certain hormones attach themselves to albumin, and this attachment helps those medications and hormones move through the body. Albumin can also attach to toxic molecules so that those toxic molecules can be removed from the body. If higher levels of albumin are seen, this can be a sign of severe dehydration, acute infection, from burns, or also stress from a surgery or from having a heart attack, whereas lower levels may indicate liver disease or malnutrition. In a nutshell, these tests provide very valuable information to the healthcare provider about the body's nutrition and overall liver function, helping the body function as it should. We now turn to the liver enzyme tests. This part of the Comprehensive Metabolic Panel focuses on 3 key liver enzymes: alanine aminotransferase, ALT, aspartate aminotransferase, AST, and alkaline phosphatase, ALP. ALT and AST are proteins that help break down proteins in your liver. When these enzymes are found in high levels in the blood, it typically suggests some form of liver damage or inflammation. When liver cells break apart, these cells release these enzymes into the bloodstream, which the laboratory analyzers can see. The reference ranges for ALT are typically between 7 and 55 units per liter, and for AST between 8 and 48 units per liter. On the other hand, ALP is an enzyme found in the liver and bone, and it helps break down proteins. A high level of ALP in your blood may indicate liver disease or bone disorders. The normal range for ALP is typically between 44 and 147 units per liter. Understanding these values and what they mean allows your healthcare provider to gauge your liver's health and function. Finally, we have the bilirubin tests. They measure the amount of bilirubin in your blood. Bilirubin, a waste product formed by the normal breakdown of red blood cells, is processed by the liver and then excreted in stool. We have 3 types of bilirubin tests: total, unconjugated, and conjugated. The reference range for total bilirubin is usually between 0.3 and 1.2 milligrams per deciliter, while unconjugated and conjugated bilirubin both typically fall below 0.3 milligrams per deciliter. However, don't be alarmed if your results fall outside of these ranges. Elevated levels can indicate liver dysfunction or conditions like Gilbert's syndrome, while lower levels are usually not a cause for concern. These tests are essential in diagnosing conditions related to your liver and gallbladder, but remember, only a healthcare professional can look at your results and diagnose any potential health issues. Okay, there you have it, the tests that comprise the Comprehensive Metabolic Panel. This panel, a combination of the basic metabolic panel and liver panel, encompasses tests for blood glucose, electrolytes, kidney function, acid-base balance, calcium, proteins, liver enzymes, and bilirubin, and provides a broad overview of the body's chemical balance. It's like a report card for your body, with each test shedding light on different aspects of your well-being. The glucose test obviously monitors the glucose levels, but also if the pancreas is working as it should, while the electrolyte tests check on vital minerals. Kidney function tests watch over your body's filtration system, and the protein tests reveal nutritional status. Liver enzyme tests keep an eye on your body's detox center, and bilirubin tests ensure your body's waste disposal system is on track. It's a window into your body's functioning, giving healthcare providers crucial insights into your health, as well as being a roadmap directing the healthcare provider towards other lab tests that can help assess the body's condition. If you found any of this information beneficial or helpful, we'd appreciate a thumbs up. So hit that like button and subscribe if you want to see more about laboratory testing and what providers look for in those tests. Remember, you are your own best health advocate, and we hope that this educational information accomplishes that for you. Thank you very much for watching, and we'll see you in the next video.